So welcome everyone. I'm Jaap and I do a PhD at Ghent University, and today I will present results of a systematic review about the influence of attention on movement-related outcomes in non-specific low back pain. So to start with, healthcare professionals that work with chronic lower back pain patients regularly experience that there is a lot of variation in how people with chronic low back pain move. And if you look into studies that examine motor control alterations in non-specific low back pain compared to healthy controls, these studies also find a lot of contradictory results. Go to the second point. So maybe certain psychological factors can partly explain why you see this great variation in motor control alterations in non-specific low back pain. And this review will focus on one specific psychological factor, namely attention. And attention to pain can either be focused on the pain, or you can distract yourself from the pain by doing something else, or you can suppress the experience of pain by trying not to think about it. And also, attention is also an important recurring construct in theoretical chronic pain models. So based on the adjusted PICO framework, namely PAO, I made a research question with these components, and the research question is: how does attention, exposure, influence movement-related outcomes, which is the outcome, in the context of non-specific low back pain, which is the population? And for these three components of the PAO framework, I made keywords, and with these keywords, I searched in the listed databases, which you see here on the poster. Okay, so then I go into the inclusion and exclusion criteria. So I included experimental and observational studies, also interventional studies, but I was not interested in the effects of the intervention on attention or movement-related outcomes, but I specifically looked at baseline associations in between attention and movement-related outcomes before the intervention was applied in these studies. So for the population, I included studies that used a sample with non-specific low back pain of all durations, so for acute, recurrent, chronic, and subacute non-specific low back pain of patients above 18 years of age. I included studies that either manipulated attention or measured it with, for example, questionnaires. And there had to be an association between attention and a movement-related outcome. And the movement-related outcome, I made a distinction between objective movement-related outcomes and subjective. And objective, in this case, I mean either quantitative measures such as EMG or functional outcomes such as, for example, the 6-minute walking test. But subjective measure is, for example, patient-reported outcomes of functional disability like the RMDQ. So I excluded those. Then risk of bias, I assessed it with a Newcastle-Ottawa scale adapted for cross-sectional studies that assesses the risk of bias in 3 domains, so selection, comparability, and outcome. It ranges from 1 to 11 stars, and the higher the stars, the lower the risk of bias. Level of evidence, for level of evidence and strength of conclusion, I use the CBO guidelines. Level of evidence ranges from level D to A, where A is the highest level of evidence, and strength of conclusion ranges from 4 to 1, where 1 is the best of the highest strength of conclusion. So eventually I screened 3,417 records, and after deduplication I had 3,400 left. I added 2 articles through hand search, and eventually I included 22 studies that were eligible for risk of bias screening and data extraction. The average risk of bias across the included studies was 47%, meaning there was a moderate risk of bias. And the population across the studies was as depicted here on the slide. So 59% of the studies had a chronic low back pain sample, 18% recurrent low back pain sample, 4.5% a subacute or acute low back pain sample, and 18% a mixed low back pain sample, which is, for example, a combination of chronic and recurrent. So for the clustering of the results, I eventually made 3 clusters. So the cluster with dual tasks, manipulation of attention, and correlational measures. I made these 3 symbols because if I go on to the conclusions of the included studies in the next slide, you can see from which cluster this result is coming from. So most studies used dual tasks, in which patients had to perform a specific motor task with a simultaneous cognitive dual task to influence attention. 5 studies used an experimental manipulation of attention, and 3 studies used questionnaires to measure attention. So now I go on to the conclusions, which I will divide in 3 groups. So subacute and acute low back pain, recurrent and chronic low back pain. And for each conclusion, you see from which cluster of studies this result is coming from. So this result is coming from the cluster that used questionnaires to measure attention. And these studies found that there is a negative association between ignoring pain sensations and trunk muscle activity during ADL tasks. And in this case, ignoring pain sensations is measured with the CSQ, which is actually a coping questionnaire. And the ignoring pain sensations is a subscale of this questionnaire. And level 3 of conclusion means that there are at least 2 cross-sectional studies with conclusions that support each other. So for the recurrent low back pain group, these results come from the cluster which used dual tasks to influence attention. So they found 2 things. One was a lower variability in postural sway during balance perturbations while people were doing dual tasks. Also increased hip motion and altered and increased variability in step length during gait during dual tasks in recurrent back pain patients compared to healthy controls. And also the level of conclusion is 3. So then I go on to chronic low back pain, also in the dual task cluster. Here the studies found a lower and delayed anticipatory trunk muscle activation during rapid arm movement tasks with dual tasks. Also, they found a lower and delayed compensatory lower leg muscle activation during balance perturbations while doing dual tasks, and also a decreased postural sway during balance perturbations while sitting. And then the last result, also in chronic low back pain, but in the attentional manipulation cluster. These studies found that there is higher activation of lower paraspinal muscles during attentional suppression as compared to the other attention manipulations, which are attentional focus, and attentional suppression. Also level of conclusion 3. So to end my presentation, I go on to the main conclusions of my systematic review. So this is the first systematic review to summarize the influence of attention on movement performance in non-specific low back pain. In acute non-specific low back pain, ignoring pain sensations is negatively associated with trunk muscle activity. And in recurrent and chronic non-specific low back pain, when attention is divided over tasks in dual tasks, these individuals are less capable to control their trunk muscles. Some limitations and problems. So there was a high variability in the operationalization of attention across the included studies, and average risk of bias was high. And now I want to thank you for your attention, and this was the end of my poster presentation.